it will sort of like inhibit the formation of P gingivalis in the plaque, right? In the biofilm. So can we conclude that it can prevent towards the formation of periodontal problems if we want to apply this study into our community?
Yes, I think our conclusion comes to we can bee pollen, because bee pollen is like really easily we can easily buy them from stores or everywhere, and then eating them will help with our so our research says it's going to help with our oral cavity, oral health, and also our intestine, and also health for our general whole body. So yes, I think we can conduct into taking bee pollen will definitely help with our oral cavity, will decrease the risk.
So it's more towards the systemic effect, right? It's not localized in the oral cavity.
Yes, it's more systemic effect.
Okay, Datuk.
You mentioned just now it also have some advantages over GI tract, gastrointestinal tract. What is the advantage of bee pollen over the gastrointestinal tract?
So beside oral cavity wise, or like
yes,
vocalize?
you mentioned just now that it also have an effect on the gastrointestinal tract.
Yes. Because
can you mention what is the advantage over of bee pollen over gastrointestinal tract?
Yes,
what is the benefit?
Because during our research, we found out bee pollen can actually increase lactococcus level in our intestinal system. So with the improved lactococcus is actually a bacteria in our intestinal system that can help us digest, and a lot of our intestine work will be depending on lactococcus. So with the increased level of lactococcus, we think it will be really beneficial for our intestine health. And other aspect also there's
Can you be specific?
More specific?
On the intestinal effect.
So far, our research only done like lactococcus is beneficial for our intestine system. We haven't go deeper.
Yeah, what is that? What does it do? The lactococcus in the intestine.
Lactococcus help us digest in our intestines. It's a main function. That's so far our understandings.
Okay, what is your recommendation of bee pollen intake in prevention of oral diseases?
Because it increases defensin beta 1, 2, and 3. And these are beta defensin 1, 2, and 3 is a main microbiome like can defend from caries.
You mentioned also not only caries, isn't it? Gingival diseases.
Yeah, but Porphyromonas gingivalis is a main reason for the gingival diseases.
Okay. All right. Thank you.
Yeah, thank you.
Can I, Datu, excuse me?
Oh, yes. Sorry, Dr. Lui.
Can I comment a bit, please?
Sure,
Thank you. Actually, hi, Loling, konnichiwa. Yeah, actually, I would like to say,
yes,
you know, there are a few, there are many, actually, not a few pollen-based, bee pollen-based products.
Yes.
Produced in China.
Yes.
And then actually it's approved there by their, Food and Drug Administration. It's actually also used in United States, Hong Kong, Japan also.
Yes.
So I'm just wondering why you don't just use it directly on human? Why you use the mice?
Oh, because with mice, we think we can control the result better, because with human, we have a lot of variations, right? Like we cannot put them in a cage and then control the environment for them.
Yeah,
So
what I mean.
Yes.
What I mean, maybe in the future you can use even human study. Yeah, I mean,
This research
it's
we're
possible.
starting, but we are looking forward to have further study with our results because there's so much more we don't understand. So we are really looking forward to go deeper in our research.
Because human study will be giving you, I mean, more what you call direct use in humans, so you can later process it
Yes.
for production. Yeah, something like that.
Yes. That will be our yes.
All right. Okay. All right. Thank you.
I tend to
Thank you,
agree
Doctor.
with Dr. Lui because I think human is better intelligence than most.
Yes, I think that will be our next
Because you
step.
can tell them what to take, what not to take. And I think
Yes.
they can be a better control.
Yes, and the result will be directly saying if it's beneficial for human health. It will be a lot more clearly.
Okay, thank you very
Okay,
much.
thank
Thank you for joining us from far away. Yeah.
Thank
And
you for all the
back to
judges.
our MC.
Thank you.
Thank you, judges and presenters. Before we move on to our last presentation this morning session, I would like to present the certificate for the presenters. Thank you for your participation in the symposium. Moving on to our last presentation, I would like to welcome Nabilah binti Muhammad Amin, Fatin Atira Husnah binti Nordin, and Junaidah binti Mahmud to present their topic, a potential ethnomedicinal a potential ethnomedicinal plant in oral health care and in vitro study of sweet basil leaf essential oil.
Assalamualaikum and very good morning. I bid to the honorable judges and the members of this virtual hall. I'm Junaidah and along with me are Nabila and Fatin Atira Husna will be presenting our elective research project entitled A Potential Ethnomedicinal Plant in Oral Healthcare and In Vitro Study of Sweet Basil Leaf Essential Oil. This is the content of our oral presentation today. Oral cavities consist of 700 different species of bacteria that is responsible for maintaining good oral health. These bacteria can cause diseases such as caries, gums diseases, and even mucosal lesion. Thousands of diseases may be initially present, especially in the oral mucosa, and it may be due to the systemic disease. 3 microorganisms were being used in this study, which are Staphylococcus aureus, Candida albicans, and Streptococcus mutant. These 3 microorganisms can cause chronic and acute oral infections. According to studies by Oza and Doshi in 2017, Smith et al. In 2003, and Ball et al. In 2014, as aureus can cause angular cheilitis and acute dental-alveolar abscess. Meanwhile, Candida albicans is known to be the main etiological pathogen of oral candidiasis and digestomatitis. Streptococcus mutans has been implicated as a primary causative agent of dental caries in humans, and one of its important virulent properties is an ability to form biofilm known as dental plaque on two surfaces. It is also known to be associated with bacteremia and infective endocarditis. Based on studies done by Magnolia et al. In 2005 and Questa et al. In 2010, these 3 microorganisms were also exhibited polymicrobial infection or co-infection in many cases of dentistomatitis and gingival periodontal disease. Sweet basil is one of the culinary herbs found in many regions such as Africa, Asia, Central and South America. Traditionally, sweet basil leaves essential oil has multiple uses such as flavoring, fragrances, and oral hygiene products. SBLEO had been reported to show antimicrobial activity, antifungal, anti-inflammatory, anti-cancer, and has analgesic properties. Therefore, the objectives of our research are to determine the antimicrobial activities of SBLEO against oral microorganisms associated with biofilm-related infection in the oral cavity, such as S. mutans, S. aureus, and Candida albicans, using this diffusion assay and MIC, MBC, MFC, as well as to determine the antibiofilm activities of SBLEO against selected oral microorganisms using biofilm eradication assay and scanning electron microscope. Next part will be continued by Nabila.
Thank you, Junaida. Now, I will present the methodology. The SPLEO used was purchased from Plant Rapi ID USA. The figure shows the GCMS profiling of the SPLEO provided by the manufacturer, showing the high percentage of linalool component. Next, this figure shows the methodology used for our study. The SREs, S-mutant, and Candida albicans were obtained from stock culture or research lab 1 in our faculty. Then, the distribution susceptibility test was done according to method described by CLSI 2012 using 98% of SBLEO. The positive control used in all experiments is chlorhexidine 0.12% for S-mutants and SRS and nystatin 100,000 IU per ml for Candida albicans. For the negative control or the non-treated group, 1% of PBS were used. The preparation bulk emulsion and micro-emulsion of SBLEO were conducted as the method described by Balizadeh et al. 2018 with minor modification. The emulsion and micro-emulsion were prepared using a low-energy method. The surfactant used on our essential oil in this study is the Twin 80. In our study also, the MIC, MBC and FC also were conducted using the method described by CLSI 2012 with minor modification. Move on to the biophilic eradication assay that was quantified by the crystal violet method described by Balonio et al. 2001 with minor modification. 5 mm sterilized glass bead were used as substratum for biofilm formation. The 48 preformed biofilm then treated by different formulation of SPLEO, negative control and vehicle control. Also, the positive control for 2 minutes and shaken at 100 rpm. The treated glass bead was stained then with crystal violet for crystal violet assay. For SEM viewing, the treated glass bead were immersed in 4% glutaraldehyde for fixation and transported to the imaging unit, Faculty of Pharmacy, UiTM Pucat Alam for processing and viewing. Now, I will proceed with the results. Figure 2 are the SBLEO used that shows antimicrobial susceptibility to SREs, S-mutant and Candida albicans. As you can see in the picture, the mean zone of inhibition are 32.81 for SREs, 32.94 for S-mutant and 32.65 for Candida albicans. Next, this is the result of MIC, MBC and MFC. The result of MIC here shows the lowest concentration is dominated by microemulsion compared to other formulation. The manufacturer recommended that the topical application should not exceed by 3.3%. Therefore, we choose 2.5% emulsion and microemulsion to be tested for biophilic eradication to mimic oral mouthwash usage. Move on to biofilm eradication results. All the formulation exhibited significant biofilm eradication activities compared to the negative control. Asterisk here indicates the significant differences in mean percentage that were compared to the untreated control according to the non-parametric Kruskal-Wallis test. The similar lowercase letters denote no significant difference according to the post-hoc Mann-Whitney analysis test. Figure 3 shows the percentage of biofilm eradication assay for S-mutant. The post-hoc analysis shows the efficacy of SPLEO 2.5% microemulsion in dispersing adhere S-mutant cells with the biofilm was higher than 0.12% chlorhexidine. Next, the SEM result shows untreated S-mutant cells that were elliptical and regular with a smooth intact surface differ from the treated cells with SPLEO at 2.5%, showing significant changes in cell morphology. The cells appear swollen and slightly elongated. The presence of cell debris were also detected here. Meanwhile, treated cells with chlorhexidine 0.12% appear wrinkled. Next is figure 4, showing the percentage of biofilm eradication assay for SREs. The post-hoc analysis showed the efficacy of SPLEO 2.5% microemulsion in dispersing adhere SRE cells within the biofilm was similar to the effect of 0.12% chlorhexidine. Moreover, the SEM results observed the untreated cells shows cell density and exopolysaccharide matrix, which were then compared to the treated cells with 2.5% and positive control that show reduced cells on the surface. Finally, figure 5 shows the percentage of biofilm eradication assay for C. albicans. The post-hoc analysis shows the efficacy of SPLEO 2.5% microemulsion, emulsion and water 5% in dispersing adhere C. albicans cells within the biofilm was higher than nystatin. In the SEM result, we can see untreated shows scattered distribution of yeast form of C. albicans and extracellular polymetric bacteria in the circle and the appearance of pseudohyphae. Meanwhile, treated cells with SPLEO at 2.5% show the clustered cell and pseudohyphae was significantly reduced, which are similar to those with nystatin, but the difference is that some clustered still can be seen in the circle.
According to GCMS profiling report, sweet bacillus essential oil (SBLEO) consists about 100 of compounds. The pie chart shows the major component of the SBLEO. The highest single components recorded are 48.6% of linalool, followed by 9.01% of 1,8-cineol and 5.65% of trans-alpha bergamottin. According to Esteti et al. In 2016, linalool is also classified as a terpenoid with antibacterial activities that specifically attack the extracellular polysaccharide of the bacteria's biofilm formation. Hence, it can penetrate the extracellular polysaccharide that protect the bacteria and degrade the biofilm formation associated with the bacteria. In our study, the MIC concentration for microemulsion was lower than the other formulation tested. In the study by Valizadeh A et al. In 2018, it was reported that the antimicrobial activities of the microemulsion essential oil are possible because it decreases the hydrophobicity of bacterial cell surface that leads to the release of DNA and RNA to the extracellular space. So this data also provide a mechanism of action of the microemulsion of SBLEO as an antibacterial agent, which it can be achieved by a better penetration into the bacterial cells and damage the bacterial cell wall. In our study, we found that sweet basil essential oil exhibits significant antifungal activities. The antifungal activities was also reported by Diaz IJ et al. In 2018, where the antifungal activity for strains of Candida tropicalis and moderate activity against the species of Candida albicans, causing the death of 99% of the inoculum within the exposure of treatment for 7.5 minutes. Their studies also reported that the mechanism of action of basillinalol could interfere the biosynthesis of the cell wall and increase the ionic permeability of the fungal membrane, which then will control the fungal infections in the oral cavity. As for biofilm eradication, the result showed a significant difference between different formulation of SBLEO in dispersing preform of 48 hours biofilm of S. aureus, S. mutans, and also Candida albicans. And according to Milesi et al. In 2013, the essential oil also kills the biofilm embedded cells by the alteration of the cytoplasmic membrane due to their hydrophobic constituent. In our study, a potential of 2.5% of microemulsion SBLEO in affecting preformed biofilm degradation upon short exposure, which is only 2 minutes, was used to mimic the clinical application of the mouthwash. Next, as for the limitation of the study, we only use a single microorganism that does not mimic the actual oral cavity environment with multi-species of normal flora and other bacteria in the oral cavity. The use of multi-species bacteria can be implemented to collect more efficacy data towards imitating the same oral environment in the next future study. Next is cytotoxic assay and the stability test is also being suggested. SBLEO exhibit antimicrobial activity and anti-biofilm activity against oral microorganisms as mutant, as aureus, and Candida albicans. Further studies of SBLEO needs to be done to provide an alternative agent in preventing and managing biofilm-associated infection caused by S. mutans, S. aureus, and Candida albicans in the oral environment. These are our references, and we would like to end this presentation by expressing our gratitude to our Dean Faculty of UiTM Dentistry, our beloved supervisors and statistic lecturers for their support and guidance. Thank you.
Thank you for the wonderful presentation. Now we would like to invite the judges for the Q&A session.
Thank you, Nabila, Junaida, and Fatin. You are full of energy. It's interesting presentation, interesting work. Okay. All right. Yeah, you all have mentioned, I think Junaida had mentioned that there is analgesic effect of sweet basil. Could you explain further how's this effect from your reading? Analgesic effect of sweet basil.
So from our research and study and from our literature review, the energistic effect. Energistic effect from SBLEO are known from the antitherapeutic agent as an antitherapeutic agent and also as a traditional medicine in treating the asthma, cough, and headache. It is also used in a cooking oil, so that make the study edible. The time edible for our study.
Yeah, I mean, can you precisely explain the mechanism? How does it relieve pain? Analgesic is pain relief, isn't it?
Yes. It also reported in Valizadeh et al. That it has anti-inflammatory, antimicrobial, and also antifungal activities. That's why we use three microbes that have microbiome.
No, I'm not concerned about the microbiome. I'm asking only about energetic effect. Tell me about energetic effect.
Because the energetic effect can affect those polymicrobial infection. That is what I mean.
Oh, it's not direct.
Yes.
Okay. All right. If you were to produce oral health products, in what form do you think that this sweet basil based product will be? What form?
We recommended after our further study in toxicity and also after stability test, we recommend about three usage in the clinical, which is the oral mouthwash as an alternative to the commercial mouthwash nowadays, as ointment because of the rapid action, 2 minutes of the action of our SPLEO, and also as a treatment for polymicrobial infection in dental patient. Yes.
Oh, okay. You mean if patient got the dental abscess, you can use this?
Yes, because we test it on S aureus, which is also the main culprit for dental abscess also. So it has the efficacy to the S aureus.
Oh, how would the product look like? If you
In
were to
ointment
use,
form, because
huh?
ointment
Ointment is also as a possible alternating for mouthwash.
No, for the infection.
For the infection, ointment.
You mean you have to rub over the abscess?
abscess. Yes, as an ointment, topical ointment.
Ointment over the dental abscess.
Yeah.
Just rub it over. Do you think it works?
Because usually we use the antibiotic, right, for systemic involvement. There is
Yes.
systemic involvement, but then we want the patient to comply to the treatment. So that's why we use the ointment as the application. Yes.
I don't think it works ointment over the abscess, isn't it? You have to drain the abscess, and I think the proper way to use it, probably you can drain the abscess and flush the cavity with the ointment, and it's more reasonable.
Can be as alternative, and further study need to be done for this alternative.
Okay, Dr. Lue, any questions?
Thank you, Dato. Thank you, Dato. Yeah, congratulations, Nabila Junaida Fatin. Yeah, well done, very well done. By doing this research, actually, you know how to do experiment, do SPSS, writing abstract. Your abstract is very nice, very well written. But actually, when we try to do something, research, we need to make a difference by improving the previous research and work. Because as you mentioned, actually, one of your references as 2T, okay, they have done actually on the Basil effect on Streptococcus mutans growth by formation, and they have measured also its stability in microemulsion mouthwash formula. So can you tell me, please, what is the difference of your research with the Astuti research?
So
Because actually, also in the literature, also it was mentioned also that Basil has also has an effect on S. aureus, S. mutans, but in separate articles. So what is the difference of your research from other previous research? Okay.
So we refer from them, but the difference from our research is that we use the SBLEO as the antimicrobial activity for 2 minutes in biofilm eradication assay, while they use the biofilm eradication for 24 hours. So when we want to mimic the oral mouthwash usage, so that's why we use a 2 minutes usage in the clinical to mimic the clinical mouthwash application. That differ our study from their study, and also their study only use the S mutants, and we tested on S aureus, S mutants, and also Candida albicans.
All right.
Just
Okay.
to add on, because we want patient to comply with the essential oil, because let's say if we use for 24 hours, patient will feel burdened to use it and they cannot maintain their oral health, and we found we afraid that this essential oil might be less effective, so that's why we only use for 2 minutes only, so that
Okay.
they still can maintain their oral health.
So this is the difference between you and the previous essay. Okay, thank you. Very good.
Yes.
Okay, thank you. thank you, Dad.
Professor Mastura, other questions?
Just to say congratulations, because I think this presentation is very good and clear, and your methodology very well done, with a very good statistical analysis. Good job lah for me. Okay, thank you.
Thank you, Prof.
Okay, just to clarify, I think you should not use ointment and just rub the abscess because it doesn't work.
Okay.
Okay,
Okay.
it's scientifically it doesn't work because unless it can penetrate into the, it have to be very, very high lipid soluble substance. Okay, make sure you got this concept right.
All right. Thank you for the study. Okay, thank you, judges.
All right, back to our MC.
Thank you, presenters and judges. Before we end today's morning session, I would like to present the new certificate for the presenters to thank you for your participation in the symposium. This marks the end of the oral presentation for the symposium. There are several programs ongoing, so stay tuned to the symposium live on our YouTube channel or tune in to our website, which is www.uitm-symposium.com. At 10:30 a.m., we are having the Special Care Dentistry Innovation Competition, and later at 2 p.m., please join in to our plenary talk by Professor Dr. Young-Guk Park from Kyunghee University, Korea, and followed by the closing and award ceremony. Thank you, and we wish you a great day ahead.
Welcome.
Assalamualaikum and a very good morning to all the honorable judges, professors, doctors, lecturers and fellow students. Welcome to the first Special Care Dentistry. Assalamualaikum and a very good morning to all the honorable judges, professors, doctors. Welcome to the first Special Care Dentistry Innovation Competition in conjunction with the 11th UiTM Dental Student Scientific Symposium. Our theme this year is Dentistry Against All Odds, Revolutionizing Research and Practice. This competition was initiated as one part of under SCD module within the BDS undergraduate curriculum. Beside the traditional and clinical teaching method, we are using the innovation component method to encourage the creativity and innovative instinct within our undergraduate students in embracing the special care dentistry. Now, I would like to introduce our esteemed judges for the session. The first judge is Dr. Ida Hasni Sha'ari, a senior lecturer from the Department of Physiotherapy, Faculty of Health Science, University Technology Mara, Campus Puncak Alam. The second judge is Assistant Professor Dr. Muhammad Firdaus Cik Musa, an Assistant Professor in Dental Public Health from Kuliah of Dentistry, International Islamic University, Malaysia. And the last one, our own Dr. Nur Hidayah Ridwan, a senior lecturer and head Center of Studies for Oral Maxillofacial Diagnostic and Medicine, Faculty of Dentistry, University Technology Mara, Campus Sungai Buloh. Please welcome the judges. My name is Dr. Tun Yasmin and I will be your moderator for this session, and our timekeeper is Dr. Aminda Faizura. Before we start, please allow me to lay down the flow for the session. All presenters must be ready at least 10 minutes prior to your allocated presentation time. All presenters are required to use the provided virtual background in our website for the Q&A session in the scheduled slot. The pre-recorded video presentation will be played by the committee for 5 minutes and subsequently followed by a 5 minutes live Q&A session by the judges. For the presenters, please ensure your camera and microphone is turned on only during the Q&A session. The bell will only be ring once it reaches 5 minutes, mark the end of the Q&A. After the Q&A ends, 2-3 minutes will be given to the judges to fill the assessment sheet. Moderator then will queue for the next presenter. In case of any technical difficulties during the video presentation or the Q&A session, the other presenter must be on standby should the allocated time be brought forward on earlier. Without further ado, let's start with our first record. Excuse me for a while. Without further ado, let's start with our first record. Without further ado, let's start with our first. Without further ado, let's start with our first. Can you all hear me now? Yeah, all right. Okay, sorry, we had some technical difficulties just now. Can you all hear me? All right, so without further ado, let's start with our first recorded innovation presentation by Team Brush and Go. Please welcome. All right, so without further ado, let's start with our first recorded innovation presentation. Now, we would like to invite the judges for the Q&A session.
Assalamualaikum. Can I start? Everybody can hear me, right? Okay, thank you. Group supervised by Dr. Ishra. That was a good presentation. So from the design, I can see that the bristle is three-sided. Am I correct? Three-sided. So what is your opinion on the effectiveness of the three-sided brush to fulfill the toothbrushing cleaning, especially at the not so easily reach areas, particularly at the back of at the posterior areas of the teeth, at the back of the teeth. Do you think it will be effective for toothbrushing for the visually impaired patients? Because I think it's very bulky as compared to the normal toothbrush that we have now. Do you understand the question?
Assalamualaikum, Doctor. Thank you for the question. My name is Dayan Hidayah. I will be on behalf of my group to answer the question. So the first question is about the effectiveness of three-sided toothbrush to brush the posterior side of the tooth. Actually, the size of the head of the toothbrush is not so big but not so small. And the three-sided toothbrush, the side on the right and left is actually already 45-degree rotate angle to the towards the gum, so it will clean effectively at that in the gingiva area. And also because of the size is as I mentioned before, it's not really wide. It's not really wide, so it can reach the posterior part. And about the bulkiness, is this is our prototype. In the future, we want to build a toothbrush with built-in refillable tube and straw and detachable head. Detachable head come with different sizes, and also the built-in means it will reduce the size of the toothbrush.
Okay, thank you. I have more questions, but I'll leave to the other judges.
Okay. Assalamualaikum and a very good morning. All right. And thank you for that lovely presentations. Actually, I would like to ask, it's a quite innovative products that where you inject the toothpaste into the blister itself, right? So if I'm not wrong, the target is for among the target group is visually impaired patient. Is that correct? So how do you think this will make it easy for the visually impaired patient to use this toothbrush?
Thank you, Doctor, for the question. Okay, my name is Mukhlisa. So I think for the visually impaired, actually we incorporate the clicking sound for the visually impaired categories to alert that a single push is actually for a single use for brushing. So that's why they can actually push the piston, and then the toothpaste will be injected on the brush, so that the amount is actually suitable for when brushing.
Assalamualaikum. I am Norshila, and I would like to add another answer for the question. Thank you for the question. And I would like to explain about why we decided to do a three-sided toothbrush. Because for visually impaired people, first when we wanted to teach them how to practice a proper oral hygiene or proper brushing technique, they might they really cannot really see how is the proper technique. maybe we can try to give them by guiding their hand. However, they cannot see which side. So that is why we try to maybe save more easier for them to use three-sided brush. When each stroke, it will brush three sides, all sides at one time. So that is why we choose the three-sided brush, and that is one of the benefit for the visual impact people as well.
Thank you. Thank you for the question. Now I would give it for Dr. Ida to ask one more question because the time is up actually.
Thank you, Dr. Tun. Thank you very much. Can you all hear me? Loud and clear, yeah? Okay, congratulations. That was a good presentation and a very innovative product. I'm very thrilled to see this product is targeting the visually impaired populations. I would like to first give credit because I can see that you have done some research about the needs of these populations. You have included the Braille component, and we have included the clicking sounds. As we know, the communicating is not only based on we communicate with them through sounds, some part of it. And my question would be, in the future, if you would like to change to make a betterment of this product, what would you change?
Assalamualaikum, Doctor. I'm Dayang. Thank you so much for the question. All right, in the future, we would like to have the built-in the tube and also the straw inside the toothbrush so that the design will not be bulky, and also we would like to have a valve to control the opening and closing at the lid at the end of the straw, so that the toothpaste can only go one way, and there will be the lid at the straw, and there will be contaminated toothpaste at the end of the toothbrush. And also we would like to come up with different sizes toothbrush, head of the toothbrush, and also different bristle. I would like to add, maybe in the future, like Diane said just now, we plan to benefit to the visual impact people. That's all.
Thank you.
Thank you, judges and presenters. So I would like to give around 2 minutes for the judges to fill in the forms that was given. Thank you. All right, while we're waiting for the judges to fill in the form, we would like to present the certificate for the presenters for your participations in the symposium. Okay, so moving on to our second innovation presentation, please welcome Team 3 Dictionary.
Did you know 1 in 6 of 1,000 newborns faces hearing problems? During this era of the COVID-19 pandemic, difficulty in communication is the main roadblock in the delivery of an effective education for the hearing impaired community. The usage of face masks has affected their reliance towards facial expressions. Looking into this matter, the hearing impaired community will face complications if oral hygiene education is to be provided without using sign language or utilizing additional teaching and hearing aids. Hence, we came out with an idea to create an application that eases the delivery of oral hygiene education for this community in a unique and effective manner. Introducing our 3D Dimensional Oral Hygiene Kit Dictionary for the Deaf, 3Dictionary. 3Dictionary, a digital dictionary in the form of augmented reality included with explanations. Firstly, download the application. A flashcard containing images of individual oral hygiene tools will be provided. Click Oral Health Education to open a scanner. Use the scanner from this application to scan the flashcard. A 3-dimensional picture of the oral hygiene tool will pop up in conjunction with a description box. 3Dictionary will be beneficial to both dental practitioners and deaf community. The commercialization values are as follows. First, helping deaf people to learn and appreciate oral hygiene care even better. Second, helping people to understand oral hygiene in a different perspective. Lastly, aids dental practitioners to convey effective oral hygiene instructions to special needs patients. For future improvement, we plan to first, provide a higher variety of oral hygiene tools such as adding floss and its variety. Incorporate sign language videos, audios, and subtitles to make it more deaf-friendly and to increase our target community. Add multiple language options. And last but not least, to convert our 3-dimensional pop-up images into 3-dimensional animations. Information through 3 dimension.
Now, we would like to invite the judges for the Q&A session, please.
Okay, thank you very much. That's a very innovative product you share with us. I'd like to ask you a question that you are planning to develop the apps for the deaf patient, right? So will you expect that they will have an issue to understand the language, the sign language, given that there are numerous various sign language? Have you tested this app? Thank you.
Hello, Doctor, and thank you very much for the question. Actually, we have already tested the app on a person who is deaf, and then they actually said it worked, Doctor. But for what we are presenting right now, the application that we presented just now, it did not include the sign language video yet inside the application, because the one that we're presenting is only the an early model, it's only the first prototype. So what we presented just now only included a description box. So we couldn't actually fully test the use of the sign language video incorporated into our product yet to the deaf community. So.
Can I ask some question? One question. There was a good presentation. So from what I understand, you are going to commercialize this product, right? So how about the hearing impaired patient who can't afford to have a smartphone, or so therefore they cannot use your application? So do you have any contingency plan for this cohort, these patients?
Thank you, Doctor, for the question. I hope I am visible and audible. Yes, that was taken into consideration when we first started actually thinking and planning about this application. How about those people who can't afford to have smartphones or anything that have screens, devices to access this application? But for now, the target group that we are focusing on are the deaf people that have access to this. And even if those people do not have access, if some groups do not have access to any devices for to download this application, what we would like to point out is that this application is also targeted to dentists who are managing patients who have hearing impairment. So for those people, they would not only be able to access this application with their own devices, but even when they go visit the dentist routinely, say, for example, twice a year, they can actually access this application through their dentist. And the another focus of this application, it is just not to help the deaf people, it is also to make communication between a dentist and hearing impaired community easier. So it works either way. I hope that answers the question.
Okay, guys, thank you very much. That was good presentations and very interactive video you have there. My questions will be considering because we are dealing with a hearing impact population. So I'm a bit concerned what be your plan because not all populations can understand one instructions. They will have a different interpretations even for one sentence. So are you going to consider to have like introductions video or introduction steps in the earlier scene of your product? Because I'm not sure if mungkin saya terlepas the introductions part about your apps. Like this app is for what, it will guide you to use this app. You may need to do this. The box will show you, it's some kind of instructions for layman person, because when we talk about giving a gadget to special populations, I'm sure we not only have to transform the sentence or instructions to a layman person's concept. So do you have any of that component in your product currently?
Thank you for the question. So currently, we do not actually have an introduction to the application that we are providing, because originally we assumed that our users will actually understand, because the name of our application is a three dictionary. It's a dictionary, and then I am sure that people actually understand what is a dictionary. And then so the dictionary will only be explaining what is for example, toothbrush. What is a toothbrush? And just going to be explaining a little bit about that. So it's not going to be too detailed. So, but we can actually consider including an introduction towards our application in the future.
All right, thank you, judges and presenters. So while we wait for the judges to fill in the assessment form, again, we would like to present the e-certificates for the presenters for your participation in the symposium. All right, so moving on to our next innovation presentation. Please welcome Team Mr. Gigi's Diary.
Today, children with learning disabilities are getting the light they need. With that, it is a quest for us to contribute to their community.
So now I would like to invite the judges for the Q&A session.
Okay, Assalamualaikum. The third group, Mr. Gigi. So that was an excellent product, so many variety of activities for the learning disabled, in those kids. So my question would be, who are you going to target? We know that's for the kids, but how can you explain more? How are you going to use it? Is it more for the dentist or the parents or the kids themselves? They're going to, play around by themselves. Can you explain more about that? Thank you.
Thank you, Dr. Hidayah, for the question. So I would like to answer this one. I'm Ashrima, representing Group D. Okay, what are we planning to do when we are producing, when we produce this product called Mr. Gigi's Diary, which is an oral hygiene education kit for children with learning disabilities. We are actually planning on to use this book not only for providing for the dental students, but also for the practitioner and also parents, the guardian, because parents, there's a possibility of negligence in our hygiene care for children with learning disabilities because they are poor cooperation when we are trying to provide a good oral hygiene care. Some parents, due to this condition, they tend to unattend any dental appointments. So by providing this book, we're actually educating and providing a medium, an aid to actually help these parents to provide at least a basic optimal oral hygiene care at home. Because at home it is a safer zone, a comfort zone for the parents to at least provide a good oral hygiene care. The basic one, which is brushing, flossing, and also the amount of toothpaste to use. So this is actually the aim of our product. The first one is the guardian. Again, I repeat, the guardian. Second is practitioner, and the third one is dental students. In hoping that children with learning disabilities are obtaining at least the basic oral hygiene care that they need to at least to have a good oral hygiene as compared to children with normal children. Thank you.
Okay, thank you very much for that great presentation. I would say, like Dr. Hidayah mentioned, there is a very comprehensive oral health education books. Yeah, the problem what I think is that who will be the focus group, like you already explained to us. Okay, I get it. It's just because in order to provide an effective oral health education, right? So you just do not only need to provide the knowledge itself. It should be supplemented with the skill, right? So that it will be in order for them to promote a good behavior change. But again, in this area, because when you deal with special need patients, definitely you are mostly rely on the caretaker or the school teachers or the parents. So I would say that the books are mainly for the practitioner or then the students, and then you can use this book as a guidance. You need to have like introductory guidance before you can easily pass that knowledge to the parent or caretakers. So it should be in a staging phase in order for you to reach the aim and objective of your product. Actually, it's well done. It's a good product. It's just quite comprehensive. Even us, a normal person, also could not follow your advice. I advise you to brush and floss teeth, floss once in a day, in a week, until you won't able to follow the advice, because to promote a positive behavior change is quite difficult. It's not straightforward. So you need to have a phase where you like to have an introductory or can pass this product takers.
Thank you,
Yeah, hi guys. That was good presentation. I like your product, very colorful. It's going to be very attractive for the special needs children, mainly for those who have learning difficulties. But my concern about this product, yes, number one, when we talk about giving a knowledge to special needs children, number one, yes, you need to address the taker. My concern when we talk about diary, I was looking something like, is there any progression schedule, or is there any stars that you're going to give to the children when they are able to do it, or when they are able to like floss their teeth 5 times a day or 3 times a day? So it's like we're going to see the progressions, because dealing with children with learning disability is about giving them reward, and you need to like make it fun. So your books looks fun. Okay, you have many tasks. You're going to make them busy with your tasks. But in the future, would you consider to include at least for the caretaker at the end of the book, maybe as an appendix or in a formal note, so that the parents can just monitor how good their child progressing in terms of certain skills related to dental care. Would you consider that?
Thank you, Doctor. Yes, we do consider, because we are always open for improvement for our product. Because this is the first batch of our book, we are planning on doing a busy book, an interactive book. But in the future, we are planning to do that. We want to increase the quality and the productivity of this product. We are hoping that when we improve this product, we'll increase the efficiency of this product and towards children with learning disabilities and also their parents, their caretaker. We do planning on that. So hoping that when the parents able to actually finish the book and see changes in their children, they can enhance more their education and awareness regarding taking care of hygiene towards for the children with learning disabilities. Other than that,
sorry. Thank you. Your time is up now. So
I'm so sorry. Thank you so much.
thank you, judges and presenters.
Okay, thank you so much.
Yeah, before we move on to the next presentation, we would like to present the e-certificate for the presenters for participation in the symposium while the judges fill in the form.
Okay, thank you.
All right, so moving on to the next innovation presentation, please welcome Team Jerry Dent. I would like to invite the judges for the Q&A session.
Okay, can I start? Okay, thank you. That was a good design. So I'm impressed with our dental student with some electrical technical skills. Okay, have you tested the efficiency of your product with real denture? Because I saw that you use, I'm not sure whether that's the patient's denture or just your constructed denture and retainers. So one, have you tested? Does it really effective to remove all the attached plugs, and then would you suggest any other liquids or solutions or any denture rinse tablet to use with your design, with your water filtration? And can you please explain the reusable? Because when I saw that reusable water, I was like, ew, no, we are not going to reuse the water being used, right? So just 2 questions. Thanks.
Assalamualaikum and good morning, and thank you for the questions. And first of all, in regards to the first question, due to the effectiveness of our product in regards to how does it can actually help in cleaning the denture. So in regards to the product that actually we are creating, we are using the small vibrations. So these small vibration that actually created from the product will actually help in cleaning the dentures. So we already tasked for the effectiveness of the dentures by putting the dentures and then see how actually how much is actually the deep cleanser works in terms of cleaning mechanism. So how does we work to actually to see how does it efficiently removing the in terms of dental plug. So we're actually using the plug disposing agents. So we actually putting we are putting the disposing agent around the denture, and after that we putting inside the water the denture cleaner. And after that we see like how much is actually the reductions from the plug, actually the reduction from the amount of the plug that from the first and then after the denture cleaning. And then from what from our finding, actually there's a reduction, but it's only a smallest reduction since from our prototype we only using the smallest small amount of vibration as compared to the ultrasonic devices that actually have in the market nowadays. They are using the very high equipment. So there's only a percentage, smallest reductions of the plug around 10 to 20% after we actually do the test for to show how does actually effect efficiently in removing the plug. And then the second one is in regards to the water filter, the reusable water. So it's actually the reusable water is from the water filter that actually we adding into the denture cleaner. So this water, this reusable water is actually function so that it will be easier for the consumers. So they just need to fill the water tank once, and then the water inside the tank will be reused back, but from the water filter. So once the machine have been completely running around 5 minutes, and then the used water, the water actually have been used to clean the denture will be filtered out together with the debris, and then it will be replaced by the new water from the water filter. So this actually that is how does the mechanism from the water filter works for our denture cleaner.
Okay, thank you very much for your presentation. I will see that the student working scientifically and technologically were done on that. It's just I would like to ask you a question is that in order for us to, or any developer to produce a product, they like to ensure that their product is safe, effective, and long-lasting, right? So how do you like to make, if there is some safety issue or effective issue or long-lasting issue, so how would you like to make an amendment to your innovative product in order to compete with the existing portable ultrasonic denture cleaner outside? Because I found, I make a quick survey, there are a few ultrasonic portable ultrasonic denture cleaner. How do you like to compete with the existing product dekat luar sana, dekat outside? What is the extra value of your product itself?
Any presenter would like to answer the question because 5 minutes is up actually. So if anybody would like to give a quick answer, please.
Hello, Assalamualaikum. Very good morning. Thank you for the question. Actually, how do we want to compete with the other ultrasonic denture cleaner itself is the additional of the water filter, just like my partner explained before. The water filter, we use small amount of water as we are recycling to use the same amount of water, and also we save the energy there. Because the water filter itself, we put it up as we want to minimize so that the geriatric patient or the denture patient no need to add up every time they are using compared to other ultrasonic devices or denture cleaner that where they need to every time they need to use another to replace another water. So as our product, we add up the water filter. So the water filter saves the amount of water and also the energy itself. So we also will collaborate with the design engineer to ensure a better product that is safe and long lasting.
Okay, thank you, judges and presenters. So before we move on to the next presentation, we would like to present the certificate for the presenters for your participation in this symposium. All right, moving on to our next innovation presentation. Please welcome Team Hashcat.
Autism Spectrum Disorder, ASD, is a constellation of early appearing social communication deficit and repetitive sensory motor behaviors associated with a strong genetic component as well as other causes. According to World Health Organization, it is estimated that 1 in 270 people in worldwide has ASD. Oral health care of patients with ASD can be complicated and challenging. They cannot verbalize complaints about any dental problem they may be experiencing, and they can display a variety of behaviors and reaction to small changes. Potential problem in managing them during the dental appointment is sensitivity to sensory input. ASD patients have extreme sensitivity towards touch, light, and sound. Discomfort experienced by the ASD patient during dental treatment can be reduced by adjusting the dental clinic environment sensitively or by using our product, Hashcat. The idea is to eliminate the discomfort felt by ASD patients through the usage of music. Their favorite songs or soothing music can be played during dental procedures in order to help calm them down and distract them from the fact that they are getting treated. The Hush Cap consists of a kids-friendly design where an attractive head cover design is used to attract patients who wear them. It is also environmental friendly where all the components can be easily disinfected after each usage. It can also provide comfort where a pair of tinted glasses is incorporated to the headphone to provide patient comfort as ASD patients can be sensitive to bright dental clinic environment. The headphone can be used to block out unnecessary noise while undergoing dental treatment and to allow patient to listen to music. Our target market are specialists in special needs, patients with dental anxiety and fear, pediatric patients, dental school, and dental clinics. Our marketing method consists of organizing an event or webinar to introduce our product, commercialization through social media, providing a product sample to clinic or dental school for them to try or to get familiarized with.
Now, I would like to invite the judges for the Q&A session.
Thank you for the presentation. I'm very interested to see whether this prototype has been tested to real autistic patients. Have they? Or only on patients with purple scrubs?
Doctor, can you repeat the question, please?
Have you tested the prototype with real patient, or if this is just a design, a new design that you propose?
So basically, thank you for your question, Doctor. So basically, we don't have tried the product yet, but this is we design first whether this is a good for the ASD patient. We want to try whether the product itself is comfortable enough for the only a normal person instead of the ASD patient. Thank you.
Thank you very much for that presentation. I would say that this product is quite straightforward, but it's of high quality because you combine to reduce any disturbance in terms of the lighting and also the audio itself, right? So what will you expect a barrier when you introduce this product to your special need patients?
Okay, thank you for your question, Doctor. So basically, as we all know, the ASD patient, there is in terms of communication difficulty and also behavior. So this thing that we want to give this product so that they can get the same treatment as a normal person, and we introduce this product so that they can get the treatment with comfortable and they can cooperate well during the treatment procedure. So what the barrier that we will face is that, you know what, they will try to, you know, to when we introduce a new product to them, they will try will not accept that. So we have to make sure that what the product is practice and can attract them so that they can wear it and they can not fight or do something that sudden movement so that we can use the product really well. That's all.
Assalamualaikum and good day, guys. That was a good product and video. My concern is that when you deal with special needs children, mainly autism, as you has mentioned in your video, they will have sensory issues. They won't be able to differentiate multiple informations that coming up to their bodies. So my concern, number one, for those children who cannot tolerate being touched, mainly at certain part of the body, in this case is the head. So how would you go through the process of introducing these gadgets to these children? And secondly, what would you do? What would be the backup plan if they don't like the songs inside your product? Because as mentioned, some children can tolerate a very different kind of music, or even macam Al-Quran recite. Some of them can tolerate that and some may not. So is there any way that you're going to have options to the music or different sounds for these children when you are applying it on your patients?
Okay, thank you so much for the question. So the firstly is that the cap itself is, I think it's attractive enough that we design so that we can attract the ASD patient. The second one is basically the cap and headphone is detachable. So the thing is that we can give them use their own headphone maybe because our headphone maybe that's not suitable for them. So they can use their own headphone to use as a headphone at his head. So the thing, the second one is that the music itself, basically it's a Bluetooth, so that we just give a certain music, meaning that the instrumental music. So we can ask their caretakers or parents to change their own music so that like like you said, like Quran and everything. So the thing is that if we can give them some option for them to listen the music that can make their calm and comfortable during the treatment plan, this is the best that we can give to them. Thank you.
Thank you.
Okay, so thank you, judges and presenters. So before we move on the next presentation, we would like to present the e-certificates for the presenters for your participation in the symposium, while the judges can fill in the sheet. All right, so moving on to our next innovation presentation, please welcome team My Kid Box.
According to Down Syndrome Resource Foundation, approximately 49% of individuals with Down syndrome experience processing challenges compared to approximately 5 to 16% of general populations. Children with Down syndrome can experience differences in the way they process and respond to sensory information. The 21st chromosome is small but powerful, having an extra copy of 3 tiny strands of genetic code as people with Down syndrome do can impact an individual in a plethora of ways. Thus, we from Group H, supervised by Dr. Muhammad Ishrafuddin, came with an idea. And this is our product, My Kid Box. The first wall is called Mash the Fruits. The food is to be matched to the teeth condition, which is healthy or unhealthy. The second wall is called Match the Pictures. The pictures consist of multiple shapes and oral hygiene kit are to be fixed in the space created by Velcro. The third wall is called Color My Teeth. The children can be asked, what if they do not brush their teeth properly? And they can be instructed to shade the tooth. What happens if they brush their teeth properly and they can be instructed to erase the shaded area before? The fourth wall is called That's Floss. The objective is to clean the interdental area with floss. The colored cotton roll were used to mimic the plug at the interdental area. The fifth wall is called Solve the Puzzle. This project can benefit for children with learning disabilities, motor skill delay, and manual dexterity. My Kit Box has the potential to be a commercialized product. This product can benefit children at the waiting area at the dental clinic. Please enjoy the rest of the video. With that, I thank you.
Now, we would like to invite the judges for the Q&A session.
Thank you, my kids box group. So there was a good invention. Okay. So apart from your presentation just now, you mentioned that this box will be useful in dental clinic. So can you suggest other groups that you're going to target for the use of your kit box?
Assalamualaikum, Doktor. Okay, our focus is actually towards the Down syndrome patient, but this box can also be used for any pediatric patient because it is interactive and it is easier for us to teach the children when they are attracted to that what we are trying to teach. That's all, Doctor. Thank you.
Okay, thank you for your presentations. It's very interesting. You put 5 in one box. My question is that if you are going to commercialize this product, what sort of amendment that you plan to do to make it fit and to be able to be marketed outside?
Maybe for the amendment, we can change because this box we just use Improbot for the prototype. But for commercialize, maybe we can change it and use plywood. More
Is there any other question from the judges?
I have one last question, perhaps. Okay. Thank you, guys, Kickbox, for your presentations. Throughout these activities that you have put on the box, what would be the expected oral hygiene skill that you would like to see on the children? As you said, you are targeting the Down syndrome children. So what would be the expected skills that you are looking at?
We are actually trying to tackle the dexterity of the Down syndrome patient. So what we hope when we are doing this My Kit box, the Down syndrome patient are able to take care of their personal oral hygiene by themselves. That is what we expect them what we expected them to have.
Thank you.
Thank you.
Thank you, judges and presenters. Before we move on to the next presentation, we would like to present the e-certificates for the presenters for your participation in this symposium. Moving on to our next innovation presentation, please welcome Team Youth Brush.
Presenting our special need dentistry innovation, the UDent brush. Supervised by Dr. Ilham Wan Mukhtar and our group leader Farha Nasrin Nasaruddin, accompanied by Group G members. Before we begin, let's talk a little bit about cerebral palsy. It is a disorder of movement and posture caused by a non-progressive abnormality of the immature brain that originates during the prenatal or perinatal period of the first few years of life. This results in significant impairment of functional mobility. There are four major subtypes, which are spastic, dyskinetic, ataxic, and mixed cerebral palsy. The clinical manifestation of cerebral palsy includes intellectual disability, seizure disorder, delayed motor development, limb spasticity, persistent primitive reflexes, and involuntary movement and ataxia. The oral manifestation of cerebral palsy includes enamel hypoplasia, dental erosion, delayed eruption of permanent teeth, dilated hyperplasia, increased incidence of Class II Division I malocclusion, and increased risk for oral trauma and injury. Here are some facts about children with cerebral palsy and their oral care that you might not know about. While 40% of the participants' children without the disorder had regular dental visits, only 23.6% of the children with cerebral palsy had seen a dentist. We are targeting a niche population mainly focusing on cerebral palsy, but other target market can also benefit from our product, such as dentists or pharmacy, patients with cerebral palsy and their caregiver, those with poor manual dexterity, child with behavioral management issues, children below 6 years old, and patients with disabilities who require constant assistance. The objectives of our innovation is to help with oral hygiene routine and care at home, reduce caries and periodontal risk of patients, reduce fear and anxiety among cerebral palsy patients during oral care at home, as well as promote positive attitude towards dental hygiene. Parents or caregiver of cerebral palsy patients often find themselves discouraged to maintain their child's oral hygiene practices, especially when their child is unable to spit, swallow, and tend to gag due to saliva and water pooling in their mouth. But fret not, our solution is the U-Dent brush. It is equipped with U-shaped tray brush connected to an electronic vibrating motorized tool and a suction pump. It is also an electronic vibrating motorized tool that moves vertical, horizontal, lateral motion instilled within the tray brush to ensure all surfaces, which is the front, back, and occlusal part of the teeth, are free of biofilm by just pressing the switch. A suction pump in the size of an adult hand grip is also available to ensure no water or saliva pulling that occurs in the mouth during the brushing process. In the current market, the readily available similar type of brush have a much bigger suction gun, yet it is portable and expensive. It is not fully trusted in terms of size, and they also have an expensive electronic tray brush. However, for our product, the U-Dent brush, it is a 2-in-1 product which are very affordable and time efficient. It is light, user-friendly, and hygienic. Some of the improvements of our product in the future include variety sizes of tray brush, a custom sized tray brush, a smaller and concise device, a wireless rechargeable mouthpiece dock, an automatic suction gun, and an app control device. So this is a live view of our U-Dent brush. It has a vibrator, a U-shaped brush, saliva reservoir, suction gun, and a power switch. Suction tips are also attached to the inner side of the U-shaped brush. Turn on the power switch and the vibrator will vibrate the brush in all directions. The suction gun will suck all the water and saliva into the reservoir and then discard.
Now, we would like to invite the judges for the Q&A session.
Thank you, U-Dent Brush Group. So I'm like very intrigued with your design. Even I want to purchase that for myself. I do not need to have any kind of movement, right? But I wish I could see how the vibrating brushes works actually, because from the design that you mentioned, you showed just now, the brushes were far apart from each other, right? So yeah, I believe this is just a prototype. That's just my comment.
Thank you, Doctor.
Okay, thank you very much, U-Dent Brush. I believe you're referring to the U shape of your product itself, right? Okay. Again, my concern is about the effectiveness of this prototype. In terms of, you know that we need four important things when you like to advise or like to deliver a good oral hygiene practice in terms of brushing, in terms of frequency, technique, comprehensiveness. All surfaces must be cleaned thoroughly and systematically. A vibrating motorized might have, but I just see a few bristles just focusing on the interdental only, right? So how you like to improve this model itself?
Thank you so much for your question. Actually, the product itself, we plan it to be bristled all over the entire U shape. So it's not actually interdentally, but with some severe technical issues that we had, we would like to show that there will be brush located at that area. But it will be not only on the interdental area, but on all surfaces of the teeth, occlusal, buccal, and the lingual, as well as the palatal.
Hi guys, congratulations. It's a good prototype, I would say. It's another dimension for oral care perspective. But my concern again, when we talk about using vibrations for patients with cerebral palsy, not everybody or not every children can tolerate such informations. Giving some too sensitive to their have hypersensitivity to their mouth or to their teeth, and sometimes by giving an extra stimulations might give them a wrong information. So when we talk about the applications of these vibrations, so I'm sure that the core of your product is the vibrations, right? So is there any research being done, or have you done any reading? What would be the suitable range of the vibration itself that can be functional for these types of children?
Thank you so much for your question. Basically, we've done several reading regarding the vibrating toothbrush that's already readily available in the market, you know, like the electronic toothbrush. The reason why we use this vibrating is to for the manual dexterity will be at ease for the patient. So there was a research that said that with this, with normal hands, we use only a few movements. So there's not much movement that's being used. So with the vibrating, it increases the efficacy and the for the plug control. So that's why we use that to put it on our product. We incorporate that into our product so that the plug control would be much more beneficial.
Thank you.
Yeah.
Thank you, judges and presenters. Before we move on to the next presentation, we would like to present the e-certificates for the presenters for your participation in the symposium. Moving on to our last innovation presentation, please welcome Team Dentersign.
Did you know that there are individuals who are deaf living about 2 million Malaysians of various ages suffer from hearing problems that affects their quality of life, especially when it comes to oral healthcare. Among the issues that arise in today's community is a lack of effective interaction between dental practitioners and the hearing impaired in identifying oral health problems. Hearing impaired individuals uses visual interactions such as writing, sign language, facial expressions, as well as mouth movements. However, in the era of COVID-19 pandemic, physical interactions became restricted and resulted in various constraints faced by hearing impaired patients to seek dental treatment. Especially when in dental clinics, the use of face masks causes difficulty in visual communication. Oral diseases such as caries and gum disease are most likely to occur without proper oral health care. Lack of access to websites or applications that have legitimate resources on proper and effective oral care methods became the inspiration and the idea to produce this application. DenSign. DenSign is an application that will help hearing impaired individuals to maintain oral health. This app can also be used by parents or guardians of children and individuals with special hearing needs to gain basic knowledge on oral health care. This initiative aims to provide information and education on oral care, especially to individuals with special needs, namely the deaf, regardless of age, by applying technology as a communication medium that can be downloaded and used via smartphones. Users such as parents, dental practitioners, and individuals with special needs can register on this app using a username and password. The app is divided into several components, namely oral care, founder, and feedback. Videos on how to brush teeth, the use of floss and mouthwash have been included along the sign language and subtitles for the convenience of users in the oral care column. This application also includes a feedback column that allows users to provide feedback for future application improvements. Thus, the app would help hearing impaired individuals to understand proper oral health from home and encourages them to seek regular treatment at a nearby dental clinic. Communication and interaction between dental practitioner and a hearing impaired patient will now be more effective and easy. Improvements to the app, such as providing more current information on oral health care and disease, location of nearest dental clinics, as well as more user-friendly apps, will be implied in the future. There are also future plans to include paid informations and contents regarding further dental treatments to enhance users' understanding and experience when using the app. The ultimate goal is for this application to have a positive impact on the target community, such as parents and guardians of children and individuals with special hearing needs, in exposing them to the basic knowledge of oral healthcare.
Now, we would like to invite the judges for the Q&A session.
All right, thank you for that lovely presentations. Dental science, okay. My question is that have you done any research on the effectiveness of mobile apps among dental patients, and how this finding you consider and integrate in your app itself? How do you add new value to your apps? Thank you.
Assalamualaikum. Thank you, the judges, for the question. As far as we all know that in this COVID-19 pandemic era, that the communication, verbal communication, and also like um, meetups are very limited and also actually not applicable in this pandemic situation. Thus, by using applications, which means like now we have mobile phones, we have iPads, we have internets and so on. With these sources, we can actually make use of it, especially in terms of educating patients, such as our targeted users, which are the deaf patients. So it actually will be very beneficial in terms of educating the patient in this pandemic era. Does that answer the question just now?
Let me rephrase the question again. How do you like to
Okay.
ensure that your patient will use apps rather than access the information from the YouTube or any other social media?
Okay. This app is actually very new, so that's we haven't actually commercialized it yet to the community. However, we plan to actually first to market the app first to the targeted community, which is the deaf community first, so that they actually know that this app actually exists for them to learn about the educational videos about oral health care. So firstly, we would like to go to the first step that I mentioned earlier. Next will be to check the effectiveness of this app, which means um, our um, our plan is to actually check the first patient clinically by using the plaque score, because we are targeting to improve the oral health, improve the oral hygiene of the patient. So when we check the plaque score initially, and then after the patient uses the app, then we know the effectiveness of this app towards the targeted community. Yeah.
Thanks so much. I have one question. What are the additional components that we like to add in the future to make your product different from other applications?
Okay. Thank you, judges, for the question. So firstly, in our app, we basically have the sign language that is specifically inserted into the videos because we are targeting the deaf community. However, in the future, we would like to add more, such as including subtitles, because in Malaysia we have different ethnicity and different community. We have Malays, Chinese, Indians, and also other ethnics. Um, so um, we would like to include subtitles in the video so that it will be more understandable, because as we know, this community, this type of people, they only use visual communication, such as writing letters, such as sign language, facial expression, and so on. So it will be beneficial in the future.
Thank you.
Can I ask one more question?
Yeah, sure, Doctor.
From your research, you do the preliminary investigations. Is there any dental health education science language for dental oral hygiene practice?
Actually, we have found a couple.
or one of them is called Odontocenas, and the other one is called, if I'm not mistaken, it's Brush DJ. So these two applications is specifically, one is actually not in our language, one is in Espanol, so it's not really that applicable if you want to try and market it in Malaysia. And one is Brush DJ, and this Brush DJ is in English mostly or entirely. So in terms of our geographical target audience, so it's rather inappropriate because we would like to focus more on the Malaysian audience. So that's why we want to include the subtitles with Chinese, Indian, Malays, and if possible maybe Iban and Kedazanes punya application subtitles. So we have done the research, and so far the ones that are specific or that are suitable for Malaysian community have not been found yet.
Thank you, judges and presenters. So before we end the session, we would like to present the e-certificates for the presenters for your participation in this symposium. So this concludes the first Special Care Dentistry Innovation Competition for today. Warmest thank you to all the judges and everyone for supporting the session. We hope you have learned and enjoyed the presentations. Now, we would like to invite the judges to go to the Google Meet link provided via WhatsApp for the winners' deliberation. The winners will be announced this afternoon during the closing ceremony. Hence, please stay tuned and support the afternoon session. See you again during the closing ceremony. Be safe and have a good day.
Thank you, everyone. Congratulations.
Thank you.
So kita leave this room lah kan? Kita keluar lah.
Kan? Oh, jom tunggu
Yes.
WhatsApp.
Can join the Google Meet link.